This is J. Randall Wilkerson, author of the Heart Failure Recovery Plan. Successful heart regeneration using metabolic enzymes. This will be part 18 of a 58-part video series of the entire book. Check out our channel for the introductory video for the background. We're going to discuss under Chapter 5, Enzymes and Supplements, the actual B vitamin niacin, also known as B3. The value is critical, that is extremely important for heart failure recovery because it provides the therapeutic effectiveness of L-carnitine in the human body. Carnitine, as we reviewed earlier, facilitates ATP energy production in the heart to increase blood flow and output. This promotes healing. Also, niacin is a major therapeutic agent in patients with heart disease, and another clinical study proved that it restored heart rhythm, coronary flow, and heart tension in subjects suffering from heart failure. The hard part about adding niacin to your diet is getting it, buying it. Most of the formulas for B vitamins in stores and online contain niacinamide. The FDA and the National Institutes of Health consider this to be equivalent to niacin, and therefore it's free of side effects such as flushing of the skin. Niacinamide may be effective for treating vitamin B deficiency diseases, but it does not work on heart conditions, especially heart failure. Only pure nicotinic acid niacin, B3, is useful. A doctor at the VA hospital system 40 years ago was treating Vietnam War vets with niacin, and when they switched to niacinamide, their mental condition became much worse than no treatment at all. It was very, very ineffective. Finding true niacin is difficult. When you look at a vitamin B bottle, you will see niacin and then in parentheses niacinamide. So that's not what you want. If you just see niacin, it may be niacinamide, and most likely it will be. True niacin over 50 milligrams in dosage, close to 100 milligrams, will cause flushing and tingling of the skin, where you'll have some redness in your arms and on your face. So far, I have found 2 B-complex formulas with real niacin in them. A B-complex contains all of the vitamin Bs, therefore it's more effective for every B vitamin if it's mixed correctly. Solgar has a B-complex dietary supplement once daily stress formula, and the product code is UPC 033984018020. The other is sold by Trader Joe's Food Markets as B-complex dietary supplement once daily controlled release under UPC code 00823258. A buyer at Trader Joe's Markets knows the difference between synthetic and natural vitamin Bs. That's truly incredible because this knowledge is very, very rare. You could take brewer's yeast in powder form, and I suspect that's what they used in the Trader Joe's tablets. You just need to mix it with juice and check to see that you have enough teaspoons based upon the label. Typical dosages for heart failure treatment and heart disease treatment is 50 milligrams to 100 milligrams twice a day. There was a false alarm study released in the New England Journal of Medicine on July 17, 2014. They raised concerns that extended release niacin in a pharmaceutical medication could have negative impacts. This statement did not actually come from the clinical itself. When I read the clinical study, I found that the greatest variance between placebo and niacin was just 3%. Most of the subjects, it hovered around 1% to 2% difference in the test groups. Given that a clinical trial often has a 5% error band, this difference is insignificant. It's less than the error rate. They did not use pure niacin. They used a pharmaceutical medication from Abbott Laboratories called Niaspan, and they used 2,000 milligrams, 40 times the recommended dosage. So obviously it was almost set up to fail. The participants were taking Simvastatin, or Zocor, a cholesterol-lowering drug with a known side effect of higher mortality rates among heart failure subjects. Half the participants, 50%, had already suffered a heart attack. 92% of the participants had coronary heart disease. 71% had high blood pressure. 34% had diabetes. And 81% had metabolic syndrome for increased heart disease risk. So obviously the study included the highest risk population in which adverse results could be guaranteed. Hardly a practical study to test for niacin's effects on heart disease prevention. Nearly everybody in the study already had heart disease. When you do research on supplements and enzymes, you will come against fairly negative reviews and attacks by special interest groups. Just follow the money, find out where it's coming from. In summary, avoid excess dosages of niacin. Some people take 500 milligram tablets, which causes major skin flushing and significant shock to the liver. In long-term consumption, PDR is often recommended against high dosages because of potential liver damage. 50 milligrams twice a day is plenty for heart failure recovery. I'm J. Randall Wilkerson, author of the Heart Failure Recovery Plan, Successful Heart Regeneration Using Metabolic Enzymes. This book is available on Amazon in print and Kindle editions, from the Apple iTunes Store in the iBooks edition, from eBay in a print edition, and directly from the publisher, Wilkerson & Hughes, P.O. Box 777, Altoona, Florida 32702. Just send a check for $24, which includes shipping. Thanks for listening.